There are different types of mental health providers with different titles and different letters that follow their names. There are psychiatrists who are medical doctors. So they are able to prescribe medication, and some psychiatrists also may provide counseling. Psychologists have a doctoral degree and the training also to treat mental health problems. They may also have training to evaluate or assess and diagnose cognitive strengths and weaknesses. But there are also master's level psychologists who work independently in Texas. Social workers have master's degrees in social work, and their training has the added skills of really helping their clients connect with local resources. Licensed counselors have a master's degree in counseling. Marriage and family therapists have also a master's degree and are trained to help couples and families, but they may also provide some individual counseling services. So you're really encouraged to let your specific needs kind of guide you in your choice for a mental health provider. For instance, if medication for a mood disorder or depression or anxiety is the primary reason that you're looking for services, then a psychiatrist would be the best choice for you. Otherwise, all the other providers, psychologists, social workers, counselors, marriage and family therapists, have at least a master's degree and are licensed to provide services in the state of Texas. So you've made that decision to pursue treatment. You definitely want to consider your situation and why you're wanting treatment, why you're wanting help. Consider a provider who works with the types of problems or concerns that you're having. A lot of providers may have a specialty. It could be they specialize in working with a certain type of diagnosis or diagnoses, or they specialize in working with specific types of problems. You also want to consider a location and office hours, and even the availability of telehealth services. Also consider if you're planning to use insurance, if the provider accepts your insurance. If that's something that's important to you, you can narrow your search in that way. If you prefer working with a male or with a female therapist, or you prefer someone of your same ethnicity. Some folks would even have a preference to work with a therapist who uses a certain religious perspective in their practice. These are all important considerations in your choosing a provider that may be the best fit for you. It's a good idea, I think, because not every provider or every provider's approach, is going to be the best fit for you. So it's important to kind of look at a couple of different, two or three different providers, and when speaking to them, briefly describe the challenges that you're having or the concerns that you're having, and you can ask them how they might work with someone who presents with those types of concerns. It's also important to ask them, are they accepting new patients? And if so, how long might the wait be before you're able to have that first appointment? after you've done your research and you've looked around, you've probably looked on some search engines, looked at some providers' websites, maybe narrowed your search for the availability of providers who can or who usually work with the types of concerns that you're bringing to treatment, um, then you're ready to make a decision. And you really want to choose a provider that you felt comfortable with. Um, Therapy will require you to be vulnerable. So that level of comfort is going to be very important in your developing a relationship, a working relationship with your counselor or your therapist. And that's something that's really important in having a successful course of treatment. So you really want to make sure, after you've thought about all the things that are important to you, whether they take your insurance, where they're located, can I have telehealth services? Are you comfortable with this person? And then, jump in and start your treatment. Now, even after you've had a few sessions and you come to find it's not working out the way you expected, you're not feeling comfortable, or you're not feeling that you're making the progress that you would like, it's perfectly appropriate to have that discussion, to share those concerns with your provider. And it's also okay to search for another provider.